can include fears of germs, contamination, or harm. Compulsions might be hand-washing, checking, or mental rituals. For some, the fear of HIV becomes the main obsession. Everyday situations like touching a doorknob can trigger intense anxiety about infection. The person knows these fears are irrational but can't shake them. Compulsions may include excessive cleaning, avoiding public places, or seeking constant reassurance and unnecessary HIV tests. Relief from these rituals is temporary. The cycle quickly restarts. HIV-related OCD shows how real-world health fears can become overwhelming mental health struggles. Let's see how each condition is treated. HIV treatment has transformed the outlook for people living with the virus. Antiretroviral therapy, or ART, uses a combination of medications to stop HIV from replicating. This allows the immune system to recover and keeps the virus under control. The goal is viral suppression, reducing HIV in the blood to undetectable levels. When the virus is undetectable, it can't be transmitted to others. U equals U. Early and consistent treatment is crucial. Modern art is simpler, often just one pill a day, but must be taken exactly as prescribed. Missing doses can lead to drug resistance and treatment failure. Regular monitoring ensures the treatment is working and manages side effects. With proper care, people with HIV can live long, healthy lives. Medical advances have made AIDS preventable for most. Now let's look at how OCD is treated. OCD is highly treatable with evidence-based approaches. The gold standard is cognitive behavioral therapy, specifically exposure and response prevention, or ERP. ERP helps people face their fears and resist compulsions in a controlled setting. Over time, anxiety decreases and compulsions lose their grip. For HIV-related OCD, therapy might involve gradually confronting HIV-related fears and learning accurate information about transmission. Medications like SSRIs can also help by increasing serotonin in the brain. Combining therapy and medication often yields the best results. Treatment must be sensitive, validating real concerns while challenging irrational fears. The goal is to break the cycle of OCD and restore quality of life. Prevention is key for both AIDS and OCD, though the strategies differ. For AIDS, prevention means safe sex, prep for high-risk individuals, and ensuring those with HIV are on effective treatment. Widespread testing and immediate care help stop transmission. Preventing mother-to-child transmission is another major success. OCD prevention is less clear.